I love that you've mentioned PCOS because so many women struggle with PCOS.
One of the hormones that can stop you from ovulating is prolactin, and so that's
Yes.
something that we need to check on people with irregular cycles.
They're freezing their eggs as insurance.
Yes. So a lot of girls say to me, "Oh, Dr. Lynn, are you going to put me in menopause by taking my 20 eggs out?" No.
This podcast is proudly brought to you by Imbibe, where clean beauty meets clinical innovation. Their products are designed to promote glowing skin, a healthy gut, and deep restorative sleep because true radiance starts from within. Welcome to For Health's Sake podcast. I'm your host, Jana Vellas, the founder of Golden Groves. Hi guys, welcome back to another episode of For Health's Sake. Today I'm joined by Dr. Lynn Burmeister, who is a renowned fertility specialist and the founder of Number One Fertility. She's one of Australia's leading voices in reproductive health, known for her evidence-based approach to fertility, IVF, and women's health. Through her work, she has helped thousands of women fall pregnant, better understand their bodies, and take control of their fertility. In this episode, we're breaking down what every woman should know about her fertility and in a way that feels really informed and empowering. So welcome to For Health's Sake, Dr. Lynn. I'm so excited to have you here.
Thank you. Thank you for the lovely introduction.
You're very, very accomplished, which is so impressive to see. And I remember actually first seeing you or hearing of you when Sonia Kruger was on the
Yes.
Today Show.
Yes.
And I remember it being such a big deal that she was maybe 40 years old and undergoing IVF and wanted to have a baby.
Yes.
So that would have been probably 10 years ago,
Yes.
maybe more.
Yes. So I think Maggie is now 12 years old.
Oh, wow.
Yeah. So she had Maggie when she was 49.
Yeah.
Yes.
Wow. Okay. I didn't
Yes.
know that.
And she announced I remember the day when she announced on TV that she came to see me with Richard Wilkins, and my website exploded with all the hits. It literally did. It just stopped working. And because she thanked me on national TV, which I didn't expect. So that was really lovely of her. So I'd helped her through her journey, to have baby Maggie.
Wow.
So, yeah.
Your impact is just incredible. And I think that's why you are one of the many reasons why you are one of the leading voices in fertility in Australia. Now, how did you even get into fertility and into opening up your own clinics in Melbourne and in Sydney? Because that's impressive to open your own clinics as well.
Yeah. So I got into medicine. I got 100% for chemistry.
Oh,
So
wow.
top the state. So I was kind of naturally good at chemistry and science and all the subjects lots of people hate, but I was probably the nerdy girl that really loved all those subjects. And I didn't really have to study much. I was just like, got really good marks and got into medicine. Didn't think I would get into medicine and got like amazing scores, and it was either medicine or law. And I said to my dad, "What do you think?" And he's like, "Well, everyone always gets sick, choose medicine, and you like helping people, so that's obviously your choice." And I got into Melbourne Uni Medicine. So I studied medicine, takes 6 years back then, and then you have to do intern year, and then you have to work in the hospital, and I just fell in love with obstetrics and gynecology. Delivering babies was what I fell in love with. So, and helping women with female health problems. And that's how I got into obstetrics and gynecology. And then when I was training, I met the professor of IVF, Professor Carl Wood, who was a founder of IVF in Australia. If it wasn't for Carl, there would probably be no IVF that started in Australia. So he was amazing. And he took me under his wing and trained me to be an IVF doctor. Then I spent a couple of years in New York with world-renowned Professor Zev Rosenwax, who treated people like Celine Dion.
Wow.
And I got to help in her care when I was working in New York as well. So I met Celine.
Oh my gosh.
Yeah, so I worked with Zev for a couple of years. So that was an amazing experience working in New York as well. And then I came back and I started working with Monash IVF. And then about 10 years ago, I decided I didn't want to be part of like a corporate organization. I wanted to give back patients doctor care fertility, doctor-led, doctor making decisions about their fertility treatment. And that's why I created Number One Fertility.
Can I say, I love that about you. And that's what I love as well about Number One Fertility as well, is also just like how bright, colorful, approachable it feels.
Yeah.
You can really tell that you care about your patients. And as I mentioned to you before we even started this podcast, a lot of my friends have come to see you whether they're having issues falling pregnant or they have like pre-existing medical conditions. And the feedback has been incredible about you. And I think that's one of the many reasons why a lot of women also are leaning more into learning about fertility is because you have made this a lot more approachable for people. It doesn't feel so distant. Now, a lot of women think about fertility and think they should be caring about the fertility prior to conceiving. I know that before a lot of my friends were trying to fall pregnant, had this idea that even though I knew I was born with all the eggs I was meant to have, it's not really something that I think about or prioritize. And it's something that I think that maybe this will be a priority when I'm trying to conceive and have a baby. But I understand that that is a misconception. That's false. When do you think that women should start thinking about their fertility?
Well, I know as a teenager, we don't want to think about our fertility, but our mums should look after that part for us. And I think if you are a teenager and you have things like period pain or irregular cycles, even at that point, you should just get it checked out. Because I even have teenagers that have come to see me over the years that are actually in early menopause.
Really?
Yeah. 19-year-olds that have been complaining about irregular periods, hot flushes, and it takes them a long time because the immediate response from a GP is go on the pill.
Yeah.
You're a teenager, your periods are irregular. So things like endometriosis are getting, diagnosis is getting missed. Perimenopause, even though it is very, very rare in teenage years, it can be missed. And we can do something about it if it's caught early. We can start freezing eggs early if someone is going to go into menopause early. So I think even as a teenager, mums should be aware to watch out for their daughter's symptoms. So irregular cycles, acne, hair growth on their face, difficulty losing weight could mean that they might have polycystic ovary syndrome. Painful periods are not normal. Painful periods often mean you have endometriosis. It should all be checked out early before it gets to a stage where it becomes very severe. And then definitely when you're in your 20s, you can take action about your fertility. So you should look after your future fertility from your 20s plus. We know that our peak eggs are actually when we're 24. And so we really need to look after our future health. So things like smoking and vaping and excessive alcohol and recreational drugs, they will ultimately affect your egg bank. So by the time we're in our 20s, our peak eggs are at that point. So we want to look after our eggs because most women are having babies around the age of 32 now. So we want healthy eggs when we're 32. So looking after our lifestyles will help our eggs later on. It's about your egg longevity. So we want to look after your eggs for later.
Wow. Okay. I didn't know that about the average woman having a baby being 32.
Yes. Yeah.
Okay. I remember I'm one of 4, and I remember my mum having me at 31. And at the time, when you're at school and everyone's comparing everyone's parents' ages, I remember thinking 31 is so old. But now that I'm 27, I'm like, 31 is so young to,
Yes.
to have your third child. But I love that you've mentioned PCOS because so many women struggle with PCOS.
Yes.
And I know that there's different types of PCOS and it's typically like a cluster of symptoms. But that's how I actually really got into wellness. Was my mum was really into wellness and health, and she took me to a naturopath, and she also took me to a gynecologist. And that's when I did a scan and they saw a surplus of cysts on my ovaries. Now, if women do have PCOS, will that impact their fertility? And if it does, what are actions that they can take to kind of halt it or to manage their symptoms?
So about 20% of women in reproductive years, when we do a scan, will have polycystic ovaries, but not everyone will have the syndrome. So the syndrome is usually irregular periods. Often girls will complain of excessive oily skin, acne breakouts, hair growing on their face, sometimes difficulty losing weight because they've got insulin resistance. So not everyone with polycystic ovaries on their scan will have the syndrome. So they need to see a fertility specialist or a GP that specializes in women's health to be diagnosed whether they do have the syndrome. And if they do have the syndrome, there are lifestyle things that they can do to help the syndrome, particularly if they are overweight, for instance. So we know that even losing 5% of their body weight will help even regulate their cycles and help a lot of their symptoms. So there are lifestyle things that we can do to help prevent polycystic ovary syndrome and help treat it. And then medically, we can also treat it as well with hormone treatment if they need help with ovulation. And also the GLP-1s, the weight loss medication, are also used to reduce insulin resistance and can actually help girls with polycystic ovary syndrome.
Yeah, wow. I have seen a lot about this, about the GLP-1s helping people to decrease their inflammation. When it comes down to having those irregular cycles, I have a few questions selfishly because I've now, within the last few years, realized that my cycle shifts a lot depending on where I'm at. So I travel a lot. I go to Greece. I spend a lot of time in the US, and my cycle is really regular. And then it's more extended when I'm here in Australia. So I started wearing my Aura ring to track my cycle and to track my ovulation. Now, if women are like myself are ovulating a little bit later on in their cycle, as in it's being delayed, what do you think is the reason for that? And does that impact their fertility? So would that impact my fertility, for example?
Not really. It just means that if you're ovulating later, you've got to wait longer for the ovulation to occur, so that then it takes longer to get pregnant. But as long as you're ovulating, so for instance, today I saw a young girl that was 28. She has 40-day cycles, but she showed me her temperature charts and it looks like she's ovulating. It just means that she's probably ovulating around day 26 of her cycle. So as long as she can pinpoint that, then it doesn't affect her fertility. It's only if her line was flat and she had 40-day cycles, then we would think, okay, she's not ovulating, and then she might need help with ovulation therapy.
Yeah. So for example, with this patient, with that longer ovulation period, is there a reason why that happens? Like, is it because of stress? Is it because we're born with our own
She's
cycle?
actually got polycystic ovaries. So she's got a borderline form of it. She is the skinny version of polycystic ovaries. So you can have the overweight version and the skinny version. So she's got polycystic ovaries, but she's not at the severe form where she's not ovulating. So she is still ovulating. There's certainly still tests that we need to do on her. One of the hormones that can stop you from ovulating is prolactin. And so that's something that we need to check on people with irregular cycles. So I'm checking that. And we need to check her progesterone level to make sure that her luteal phase is sufficient to hold a pregnancy as well. So there's hormones we check when girls are diagnosed with polycystic ovaries.
Okay. So the prolactin, correct me if I'm wrong, prolactin is the hormone that you produce when you are pregnant and breastfeeding. So that produces milk.
Yes.
And then progesterone. So what I understand is progesterone and estrogen are your two female sex hormones, and they're meant to be within balance. And what matters is that ratio between the two hormones.
You can be estrogen dominant, and that might mean that you're not ovulating. Progesterone happens after we ovulate, and that is the hormone that makes you a bit grouchy.
Yeah.
So that's a nasty hormone that we get in the second half. So we've got the friendly estrogen hormone that makes us feel great and makes our skin glow, and that increases when you're pregnant. That's why you get the pregnancy glow. And the progesterone's a bit of the grouchy hormone that makes you get all the PMS symptoms and things. So, and makes us break out in pimples. So progesterone's part of the opioid family, which opioids make you tired and lethargic. So it's not, we do have hormone changes in our body each month. So we don't make it up. It is actually a real thing. Yeah.
I know. And this is the thing. I think now that there's become such a big trend for like training for your cycle, eating for your cycle, we're actually getting to know our bodies a lot better. Like I know for myself previously, I used to expect to show up every single day in the exact same way because I didn't understand my hormones. And then after reading books like Fast Like a Girl and learning more about my cycles, it makes sense that you're more tired right before your period and you might not want to exercise as much or feel bloated or unmotivated.
Yeah.
But overall, if you are doing all the right things, let's say, for example, if you're not having a processed diet, let's say you're following an 80-20 rule, you're exercising, you're limiting your exposure to stuff like fragrances and other xenoestrogens, but you are still struggling to fall pregnant naturally. What are some of the main reasons why this occurs within women that feel like they're healthy, but they can't conceive naturally?
So, one of the most common causes is ovulation disorders in women and other conditions such as endometriosis or blocked fallopian tubes. Sometimes stress and anxiety can stop us from ovulating, and sometimes over exercising. If we over exercise, we can stop ourselves from ovulating as well. And people that really limit their carbohydrates and their protein intake can also stop ovulating as well. So, we need a bit of nourishment for our body to continue ovulating. But a big factor in fertility is also the male factor. So it's almost 50-50. So people forget about the males. So it's almost equal, like 50% it will be female, 50% it will be male factor. So it's always important to remember the guys in the situation as well.
I know it's really funny that you even bring that up because it's something that we often forget. I know for myself, I often forget. What role, when you're saying that it is 50-50, what role do you think men should play in the fertility journey? I know that I saw this TikTok that went viral last year, and it said the 9 months prior to a woman conceiving are like the most important months for a man where they should be taking care of their health.
Yes.
I'm not sure if that's myth or it's fact,
Yeah.
but what should men stop doing and what can they do to support their partners on the fertility journey?
So both eggs and sperm take about 3 months to go from a state of immature to maturity. And so we've got 3 months to prepare. So in those 3 months, we want to have at the end of the 3 months Olympic athletes because they're going to be your babies. So we want the really smart child, the athletic child, the child that does really well at school. So you can actually do those things to influence the health of your child. So preparing for pregnancy is really important. And so those 3 months leading up to conception are really important. And a lot of guys come in, I'll say, do you vape? Do you smoke? Yep, but my sperm's perfect. Well, no, you're affecting your DNA and your sperm by vaping and smoking and drinking excessive alcohol and being overweight. When men are overweight, it squishes their testicles in their trousers, and the weight from their tummies is causing lower sperm production and poor sperm production and also DNA fragmentation in their sperm. So we want the healthiest sperm at the end of that 3 months. So no vaping, smoking, laptops, no laptops on their laps. Try and cool. I always talk about cooling the testicles. So no long saunas and things, even though we know saunas are beneficial for our health. So I don't say to men avoid saunas, but try and limit your saunas as well when you're trying to conceive. So bike riding, excessive bike riding. So anything that squishes those testicles can affect their sperm.
This is crazy as well, how sensitive the male sperm is. I just think I learned about the sauna thing recently. One of my friends, she was trying to have a baby and they couldn't fall pregnant, and it was the saunas. And I said to her, look, at least your husband's saunaing instead of vaping or taking recreational drugs. I'm like, at least it's very,
Yes.
This podcast is proudly brought to you by Imbibe, where clean beauty meets clinical innovation. This is an ingestible skincare brand I have been using for years and swear by. I add a teaspoon of the Miracle Collagen into my morning coffee every single morning, and it has helped grow my hair to be so long, thick, and luscious. I have a discount code FHS20 where you can access 20% off all of Imbibe's range for the podcast live dates, which are March 11th through to May 11th. This excludes sale dates, which are March 17th through to March 23rd. I promise you guys are going to love these products just as much as I do. Happy shopping. If women are trying to conceive naturally and they can't, and, it might be an issue with the male sperm or with their eggs, how long should you try to conceive naturally before you look into something like IVF?
Most people will try for about 6 months and then they kind of get fed up with it, and then they'll see someone like me or they'll see their GP. I think it's not a bad idea to pop along to your GP and get a pre-fertility assessment, which could be a semen analysis. And for women, just a hormone profile, make sure their egg bank is fine, make sure they're ovulating so they're not wasting 6 months.
Yeah.
Because if you try 6 months and then something is wrong in the background, which could have been fixed, then they've kind of wasted 6 months. So I think having a pre-fertility assessment is a good idea. You need to see a GP as well to go through genetic testing as well, because it's important to talk about genetic testing before you conceive as well, such as cystic fibrosis. So 1 in 25 of us carry the gene for cystic fibrosis. So if your partner's carrying that as well, then you've got a 1 in 4 chance of having a baby affected by cystic fibrosis. So all those things are really important to have checked before you even start the conversation of having a baby.
Yeah, wow. One of my friends, she has cystic fibrosis, and she did that test, and so did her husband.
Yes.
And she was so relieved that he
Yes.
didn't have it as well, because she said to me that would carry on to my baby.
Yes.
The other one that I've heard about as well is thrombosis.
Yes.
Is
Yeah.
that correct?
Yes. So that won't necessarily stop you from having baby. It can increase your risk of miscarriage.
Yeah.
So there's the most common one that we talk about is factor V laden, which increases blood clots in your legs and your lungs. And when you're on the pill, for instance, you could get a sudden blood clot if you're carrying that gene. So usually there's a family history of it, like your mother might have had a stroke or might have had a blood clot in her lungs, or your father might have had it. And then your doctor will recommend that you have factor V laden. But there's lots of other blood clotting genes as well. But thrombosis can be associated with recurrent miscarriages as well.
Yeah, wow. I know my cousin, who I mentioned before, he's visiting from Greece, and he's a gynecologist. And he says to me, in Greece, you have to get the thrombosis check done before being prescribed the pill. And if a woman miscarries once, they'll make her have this test done. I'm not sure if that's a regular occurrence in Australia.
In Australia, it's usually 2 miscarriages, and then we do the thrombosis test. But yeah, I mean, we can do it whenever the patient requests, though, really,
Yeah.
particularly if they've got a family history of recurrent miscarriages or a family history of thrombosis. I would definitely do it.
Wow.
Mm.
And then if women are doing this hormonal testing, let's say it's been 6 months, they can't conceive naturally, what day of their cycle should they be doing this hormone profile testing, and what should they be looking for specifically?
Yeah, so what we normally do is a day 2 blood, looking at their FSH, LH, and estrogen levels. And that tells us if they're kind of in perimenopause. So that alarms us if there's any signs of perimenopause. And then an anti-Müllerian hormone, which is your egg bank test, is really important as well. And that tells you where you are with your egg bank. So it's like an egg bank gauge, or I call it the egg gauge. So it's a bit like petrol in your car. You can't see your petrol, but you're relying on the gauge to tell you how much petrol you've got left. So it's your egg gauge. So it tells you how many eggs you have left. So we do the egg gauge test, which is the AMH, and then we usually do a luteal phase progesterone to make sure that the person is ovulating. And sometimes we'll do prolactin level if their cycles are very irregular.
Yeah. So with the egg count, or the egg gauge, sorry, let's say I was 30 years old.
Yeah.
What would be healthy? Like, what would a healthy profile look like?
Yeah, so your egg gauge could be anywhere from 0 to 69 at your age. And I mean, it's great if it's really high, but then that might indicate you've got polycystic ovaries if it's really high. So in any egg count or AMH count above 24 might indicate polycystic ovaries. So a healthy AMH is probably around 15 to 20. That would be a good number.
Okay, interesting. I'm now going to ask my sister. I know that she did hers recently. I'm going to message her and be like, hey, what was your AMH level?
Yeah.
I think she was happy with hers, but do you think that that is a really good indicator? Because I've heard mixed things from people about it being a good indicator of how easily you'll be able to conceive naturally or not.
Not normally, really. It just tells us that if you do have a good AMH, your longevity for your eggs will be longer. So you won't be someone that goes into early menopause, which is good. And also from an IVF perspective, I know if I have a patient with a really good AMH, I'm really happy because I'll get a lot of eggs from her. Whereas if I've got a patient with an AMH of 1, then I know that I might only get 1 or 2 eggs from that patient. And that's really hard to get that patient pregnant when we only get 1 or 2 eggs. So the more eggs we get, the higher the chance of a baby. So for instance, with egg freezing, if a patient's under 35 and we get 20 eggs frozen on that patient has a 95% chance of having a baby from those eggs.
Wow.
Yeah.
And does the egg freezing impact you from conceiving naturally? Because I know a lot of people let's say I know a lot of my friends, especially in New York, they're 30 years old, they don't have a partner, or they have a partner and they don't feel ready yet to have children or get married. They're freezing their eggs as insurance.
Yes.
Now, if they were to try and have a baby naturally, would that impact their chance?
Not at all.
Okay.
So a lot of girls say to me, oh, Dr. Lynn, are you going to put me in menopause by taking my 20 eggs out? No. So every month we're losing our eggs. They're just
Yeah.
like dying every month. So what we're doing is I call it the egg rescue mission. So we're rescuing your eggs from dying. So we're getting those 20 eggs that were going to die that month and we're putting them in the freezer. We're snap freezing them. And we know that a frozen egg will behave as well as a fresh egg now with our technology.
Oh, wow. That's
Yeah.
incredible.
Yeah.
Can I say, because that's the part that I feel like in the fertility journey that feels a little bit unfair for women and for men, because I know so many of my friends, they do not feel ready
Yes.
to have children yet, even though they are 30, 31. They're
Yes.
really cognizant of the fact that their fertility is slowly starting to decline.
Yes.
But then the guys that I know that are in their 30s, it's not even on their radar.
No, often till they're 40. Well, the population rate now, we're only having 1.4 babies per couple. So we're actually becoming extinct. So
That's
we're not
crazy.
replacing ourselves at the moment. So I think egg freezing is a great thing to do. And what I'm seeing a lot of my patients doing, egg freezing around 32, they have babies naturally at 34, 35, but then they come back and see me at 38 because then they're struggling.
Yeah.
And then we can get their little 32-year-old eggs out of the freezer and they're hopefully lucky enough to have another baby from their 32-year-old eggs.
Oh, wow. That's
So
incredible.
it's like an insurance backup plan for baby number 2.
Yeah.
Yeah.
Wow. So you would recommend in most cases that women should egg freeze at 32? When should they start looking into it?
So if we look at our peak eggs, 24, but most people won't recommend freezing eggs at 24. It's a little bit too young because you might meet someone at 26 and have a baby at 28. So then you'll never use your eggs. So I think when you're around 27, 28, get your egg bank tested. If it's okay and looking good, then I'd probably say between 30 and 32, if you're not ready to have a baby, at some point then I would recommend egg freezing.
Okay.
That's the most common age where we'll see people using their eggs. Whereas if you freeze your eggs at 25, it's highly likely you will not use them.
Yeah. Wow. Now, you mentioned something previously that I want to revert back to. You mentioned GLP-1s, and I watch a lot of doctors in the US and naturopaths. And I know when it comes down to fertility and enhancing a lot of women's fertility, they've been prescribing microdosing peptides to
Yes.
enhance women's fertility.
Yes.
What is your opinion on it?
Yes.
And is that something that you do within your clinic?
I do it for people with high BMIs because we know that high BMI increases their risk of miscarriage, difficulty getting pregnant. So I actually do prescribe it for women with high BMIs. But there are things that are emerging about GLP-1s, anti-inflammatory properties, lowering insulin resistance. We know that insulin, particularly with girls with polycystic ovaries syndrome, is usually high. So if we can lower their insulin, it will decrease their risk of miscarriage. So it's emerging evidence that it will probably help girls with polycystic ovary syndrome, but definitely people who have high BMI. I spoke to a girl today who's thinking about freezing her eggs, and she's lost 10 kilos on GLP-1 from the start of the year.
Wow.
So, yeah, she's done amazingly well. So she wants to egg freeze now. She's at a healthier weight because her eggs will be healthier because she's in her normal body mass index range now.
Yeah, wow. I think there's a lot of backlash about the GLP-1s, but it does help so many women as well. And I think even becoming more aware of a lot of their symptoms because they might not realize that their symptoms aren't normal.
Yes.
I find this crazy because I've always been like pretty consistent, healthy weight, really health conscious. But what I learned recently is part of insulin sensitivity is also the darkening of the skin, which is
That's right.
what a lot of people with PCOS see.
Yes.
And my godfather's a dermatologist, and I showed him that it's so minor, this little patch. It looks like I've got fake tan on my neck. And I was speaking to a doctor I know, and he was like, that's actually a sign that you had insulin sensitivity. So I think I've been fortunate in that I've worked really hard at adopting some lifestyle changes.
Yes.
That's really worked for me.
Yes.
But sometimes, especially when, time isn't necessarily on your side,
yes.
GLP-1s can be amazing, super transformative for a lot of these women and their health.
Yes, definitely.
When it comes down to lifestyle changes like diet and supplement, what do you look at and what do you recommend in your clinics?
Well, definitely a pregnancy vitamin with a good folic acid in it and some choline, because a lot of pregnancy vitamins actually miss choline. So we get choline from eggs, but you often don't get enough choline from eggs. So you've actually got to take extra choline. So it's a supplement that we don't talk about in pregnancy, but choline's really important for your baby's brain development. So a lot of the big brands, I won't mention names, but they are missing choline in their pregnancy vitamins. So important to look at your bottle and make sure you've got some choline in your pregnancy vitamin and folic acid. And now there's new evidence that methylated folate might be better than the older folic acid that we've been telling women to take for years, but then there's still no data or studies about methylated folate.
Yeah.
So it does receive a lot of criticism from obstetricians, but the newer version of folinic or methylated folate might be a better folic acid to take. So definitely a good pregnancy vitamin with choline and the right amount of folic acid. And then other supplements that have been shown to improve egg quality, coenzyme Q10. So, that can help your egg quality and sperm quality, and melatonin can help your egg quality as well.
Really?
Yep. And now there's some emerging evidence, only in animal studies, that NMN can help your egg quality as well. So they gave infused mice that are older with NMN, and then they compared them to younger mice having babies, and they matched their pregnancy rates, so which had never been shown before. So I now tell my patients to take NMN at 500 milligrams. It's actually really hard to get in Australia. I found it in a health food store, but I think it's slowly coming to pharmacies now.
Yeah, I saw a brand, Wonderlust, just dropped NMN and they had sent it to me. I haven't tried it yet, but from what I understand, does that boost your NAD, which is
Yes,
your
yes,
cellular energy and
yes.
function?
It's a
Okay.
precursor to your NAD, and your NAD is what fires up your mitochondria, and your mitochondria is the lighthouse to your cells. So as we age, our mitochondria dim, and just like a light dims as it's getting old, so the mitochondria dim in our cells, and that's why we get wrinkles, gray hair, and changes in our body. So if we can boost up our mitochondria where the energy is being produced in your cells, then it can be seen as an anti-aging supplement.
Oh, wow.
Yeah. That's why a lot of people even go off to these young clinics and have NAD infusions. Now, there's no proof behind all that.
Yeah.
But so there's a lot of movement in that NAD space.
Yeah, I did. I went to a retreat and it wasn't an infusion. It was one of the pens and I was really apprehensive. It was a small dose. But I know a lot of people have been doing the IVs and they haven't been feeling that great after doing
No.
them, especially when you take high amounts.
Yes.
So I'm like,
I
not
know
necessarily.
it's like it's not proven. We don't know whether it's harmful yet either.
Yeah.
So a bit like the peptides that in the wellness sector where people are being prescribed or not prescribed peptides, they're taking peptides in the grey zone
Yeah.
because they're not legal yet. In the only peptides that are legal are insulin and GLP-1. They're the only two peptides that are currently legal. Otherwise, they're still considered experimental treatment because we just don't know about their safety at the moment. Yeah.
I know. We had her on, my doctor from Everlab, and Dr. Eldie, she was talking to us about a lot of the peptides, and she said she's seen in her patients really great improvements with GLP-1s.
Yes.
But when it came down to taking peptides that haven't necessarily been regulated yet or haven't passed the 3 stages of testing,
Yes.
she's seeing a lot of different concerning symptoms, like anaphylactic reactions.
Yeah.
I know a lot of people that take them. I think
Yes.
that I feel like pretty much everyone.
We know that people are taking them. We know that.
I know.
We know that people can get them through their gyms, and we know that people are taking them. That's just out there, but it's certainly a grey zone, and it certainly needs to usually only prescribed by a doctor, but they're not TGA approved yet, so we can't prescribe them anyway. So they're only experimental at the moment.
Yeah.
Yeah.
Oh my gosh. So with things that people can control and which there is a lot of proven evidence and science, does diet play a really big role in fertility? Like if people are either undergoing IVF or they want to prepare for pregnancy, what type of diet or lifestyle do you think would be ideal for women in this situation?
Yeah, well, it's actually been well studied and proven that the Mediterranean diet is the healthiest diet to follow. So that's
Love it.
fish, chicken, and, vegetables, red, green, yellow vegetables. Cooked tomatoes release lycopene. So a raw tomato doesn't. Raw tomatoes do have high vitamin C, but when you cook a tomato, it releases a really strong antioxidant called lycopene, which is really good for your eggs and sperm. So Nonna's pasta is very good for you.
Okay, that's so good.
Yeah.
'Cause I know that you're married to an Italian, so I'm like,
Yeah.
I hope you're having a lot of
Yeah.
pasta.
Yeah. Lots of well, my children grew up on Nonna's pasta, so yeah.
That
So
is the
hopefully
best.
they'll have good eggs and sperm.
Okay,
Yeah.
that is so good. And as well, especially coming from like an expert, I'm
Yeah.
like,
Yeah.
it's incredible. I feel really lucky as well because with me, with the Mediterranean diet, both my parents born in Greece,
Yes.
I still follow that. We were just discussing this before. I find that eating closer to your genetics and your DNA, that at least is what has worked for me.
Yes.
Now, if people were thinking about preserving their fertility, what is one thing that you think our listeners could adopt and introduce into their life? What's the one takeaway that you give your patients?
Looking after their eggs, even from a young age. So really look after your eggs in your 20s. Like we only, when we get to have a baby, it might be hard to have a baby. So the healthier eggs I have in my lab, the higher chance I will get you a baby. So looking after your eggs, even in your 20s, and try and stay clear of recreational drugs and vaping and smoking and excessive alcohol. I know it's all fun to do in your 20s, but it may affect your egg quality in your 30s when you're ready to have a baby. So I think that's the one thing, the one message, that whatever we do, it can affect our eggs because our eggs are there right now.
Yeah.
And we can influence the quality of our eggs later on.
Yeah. Thank you so much. Can I say, I feel really lucky because that's not me. I'm like, not the excessive drinking, not the vaping, not the smoking, not the drugs. I'm like, I pray to God that my egg quality is great. And
Yes.
I think the really big thing for me will probably be the stress.
Yes.
Thank you so much for
Pleasure.
coming. It was
Thank
so
you for
great to
having
hear from
me.
you.
Yeah.
I think
thank
so
you.
many women as well are going to gain so much from this episode, particularly realizing that they need to be caring about their fertility from now. So thank you.
Yeah. Thank you, Yana, for having me today.